Morning, folks. My name is Mel Packer. I'm the Green Party candidate for the U.S. Senate in Pennsylvania, trying to get on the ballot by collecting signatures. This is the second of my video blogs that I said I would be posting. We'll post it to my website at melpacker.com, but also to YouTube and Facebook. Sometimes I'll comment on the news, sometimes I'll comment on an issue that needs to be discussed. This morning I'm going to comment about healthcare because of something that happened to me. At 7:30 this morning, I stood on an object that I should not have stood on, frankly, and fell to the ground, crashed down, and got a laceration or a cut to the right side of my face. You may have noticed that already. I had to go and get that stitched up. I went to an urgent care provided, or that's part of my medical provider, University of Pittsburgh Medical Center. I got adequate care. I had to pay a $30 copay when I walked in the door. I certainly received good care. I was in and out in 1 hour, and I had 4 stitches to my face. No big deal, a minor procedure. I want you to think about the folks who don't have medical insurance. Because of my job, my wife's job in particular, my family enjoys medical insurance. We pay a good portion of that, the employer pays a good portion of that, but nonetheless, we go in, we have a procedure done, and there's a set rate that the employer or the insurance plan will actually pay for that. My guess is this bill is probably going to be billed out at about $500 to $1,000 for this minor procedure. It will already have been negotiated down by a set standard. My guess is that it will be reimbursed at $150 to $200. The average person without health care will wind up going to an emergency department where they must be seen even if they don't have health insurance, unlike most urgent cares. They will be admitted into the department. They will have the procedure done. They may wait 2 or 3 hours. They will get adequate care. They will have the laceration closed. And they will receive a bill, because they are quote-unquote self-pay, of between $500 and $1,000 at a minimum for that laceration repair. That will not be negotiated down. That will be the absolute bill that they're stuck with, and that will hang over their heads. They will get that bill over and over again. They will go to the hospital and ask that it be negotiated down. They may be able to negotiate it down somewhat. They may be able to plead poverty and get some charity care. But in most cases, that is the bill that will hang over their heads. Eventually, like many cases, it will be turned over to bill collectors. It will show up as a bad credit rating, and some of those people will wind up declaring bankruptcy because of something like this and as minor as this. Approximately 50 to 60% of bankruptcies in this country today are caused by medical costs. This is due to the lack of universal health care. Universal health care should be provided for everyone. There shouldn't be any questions asked. People should not be having to declare bankruptcy because of something as simple as what happened to me this morning. I urge you to work for that, to fight for that. If you find disagreement with me about this, I urge you to support my candidacy. You can go to melpacker.com. You can volunteer there. You can see it on Facebook, YouTube, and I urge you to share it with others. We must collect 20,000 signatures in the next 60 days in order to get me on the ballot in Pennsylvania. Thank you.